Hi everybody, welcome to Dr. Manny's YouTube Learn Shops. In this session we look at nursing science knowledge, and we try and determine what it actually is. So our learning objectives, looking at it philosophically, are to review the concepts related to what's knowledge, types of knowledge, nursing theory. Nursing, is it a science? Nursing, is it a discipline? Nursing as a profession and the paradigm of nursing. Look at nursing trends and the future of nursing. A lot of it is philosophical. Okay, nursing. Nursing, theoretically and realistically, is a combination of nursing knowledge and skills. It's about theory, and theory is about what is known, and practice is about what is done. The theory-practice continuum. And both require you, me, nurses, to have cognitive thoughts about the process and these skills. Think about it. So nursing as a science then is flexible. It's definitely evolving. It situates nurses in a role which requires them to articulate knowledge effectively. That's important. That word, effectively. Okay, so what's knowledge then? Knowledge is facts, information, and skills acquired through experience or education. It's the theoretical or practical understanding of a subject, and it incorporates facts, propositional knowledge, skills, procedural knowledge, objects, acquaintance-related knowledge. Knowledge, it's the philosophical study of knowledge that's called epistemology. And this is an important term or concept that you'll have to understand as you go through your program. When we look at sources of knowledge, the sources of knowledge are essentially scientific knowledge, traditional knowledge, knowledge which is based on intuition and tacit, and personal knowledge. Scientific knowledge, it's basically measures and tests. It's systematic and methodical. It involves in research processes quantitative, qualitative, and mixed methodologies. It uses inductive approaches and deductive approaches. Again, terms that you're going to have to become familiar with. Scientific knowledge basically is what we learn from the scientific process. It involves experimentation and collecting data. Scientific research is collecting data to investigate and explain a phenomenon. Another term that you're going to have to get familiar with. Scientific knowledge then is based on empirical evidence which identifies and has accurate examples of data that's used for evidence. Then we have traditional knowledge. And traditional knowledge is knowledge and practices which are passed down from generation to generation. And they're from traditions or a form of heritage which relate to certain communities, of which nursing is a community. So for nurses, it's knowledge passed down through generations of nurses. And this is conveyed through observed practices, role modelling, written documents and journal articles, books, experiences from practitioners. Traditional knowledge practices, they can be imposed by statements such as, gee, this is the way it should be done, because this is the way it's always been done. And it can lead to the development of a nursing culture that accepts practices without questioning the foundation and the evidence base, which we'll be looking at when we look at evidence-based practice in forthcoming sessions. Then you've got knowledge that comes from intuition, or knowledge that is referred to as being tacit. Tacit knowledge is the knowledge that you can't express in words, and it may play a role in learning as a science, yet tacit knowledge is difficult to study directly. Tacit knowledge essentially is the knowledge that we all possess, and it comes from personal experience and context. It's the information that if someone asked you would be really difficult to write down. It's difficult to articulate or present in a tangible form. It draws on knowledge, as I said, from experience, practice experience, but scientifically it lacks objectivity, and it lacks the ability to identify a rationale for your decisions. Some of us call it a gut feeling. It's also intuition, and intuitions are defined as tacit hunches or feelings that influence your thoughts with no conscious effort at all. They just happen. It's an immediate form of knowledge in which you, the knower, is directly acquainted with the object of the knowledge. In psychology, intuition encompasses the ability to know valid solutions to problems and decision making. It's an important method to identify, and we sometimes call this brainstorming. However, as I said, there are criticisms from the scientific community that intuition and tacit knowledge lack objectivity and the ability to identify a rationale for decisions. I did it because I thought I should do it. I thought something was wrong because I thought something was wrong. You don't know how you know, but you know you know. You know you knew, and that's all you need to know. I did it because I thought something might happen. I escalated the problem because I thought there would be a problem. Sometimes you're right, sometimes you're wrong. Sometimes it's confirmed, sometimes it's not. Intuition and tacit knowledge is a very important knowledge base in nursing. And believe it or not, it's evidence-based now. You can go to the literature and look about nursing intuition. Then you've got personal knowledge. And personal knowledge means knowledge of a circumstance or an issue or a fact that's gained from your first-hand observation or experience. It's individual knowledge that's acquired by you, and it can be developed, if you choose to, through reflection on practices on a wide range of experiences, which again will be important for you in this course and as a nurse. And it can be based on a variety of sources of knowledge. Now let's look at nursing theory. Well, what's theory? Well, in the Latin, it means to view something. In the Greek interpretation, it's to contemplate or think about something. Nursing theory is a body of knowledge that was shaped by nurses and how they see the world. Nursing theory, it's a group of related concepts, definitions, statements that propose a view of phenomena, that describe, explain, or predict outcomes. And they can be abstract views, concepts, notions, or philosophies. Nursing theory is defined as a creative and rigorous structuring of ideas that project a tentative, purposeful, and systematic view of phenomena. And it's through systematic inquiry, whether in nursing research or practice, nurses are able to develop knowledge relevant to improving the care of their patients. Nursing theory explains, describes, predicts, prescribes, and this all relates to your patient care. Why then is nursing theory important? Is it important? Well, nursing is acknowledged as a profession, which we'll be discussing, as an academic discipline that contributes to society. It supports guides nurses when the theoretical knowledge base is rigorous and reliable, which means nurses need to be evidence-based. It provides criteria which are valid to the nursing's professional status within a distinct body of knowledge. So we're respected as healthcare professionals. And it has an ultimate goal to provide excellence in clinical practice. And if you provide excellence in clinical practice, you're a patient advocate. And if you're a patient advocate, you provide patient safety. Nurses are patient advocates. It's a term that I don't often hear used frequently or consistently in nursing. So professional nurses and nursing theory. What's the rationale? Well, the rationale for nursing theory is that we collect and analyse data that pertains to our patients. It's comprehension and linking of the data for care decisions, theory practice. It distinguishes essential and less essential data. So it makes you think critically to determine what's important now and what might be important later. Less essential data isn't irrelevant, it's just not considered critically, immediately, acutely. Later on, it can be reflected on. Generating precise clinical judgments based on valid evidence-based research. And it involves planning and evaluating outcomes of care. You can think of it as the nursing process. Let's review some of our nursing theorists. And I think this is important for you to be exposed to if you don't know, and possibly reflect on their contribution. And this is about nursing theory. And the primary purpose of theory in the profession of nursing, as I said previously, is to improve practice by positively influencing the health and quality of life of our patients. And these theories are crucial to the concept of nursing. And the nursing theorists were crucial to the nursing profession, or establishing nursing as a profession. The nursing theorists provided foundational knowledge of care concepts that enable those in the profession, us nurses, to explain what they do for patients and why they do it, the reasons for their actions. Because if it can't be explained, possibly it shouldn't be done. Possibly it may not be evidence-based. Florence Nightingale, she was our first nursing theorist, and she established nursing as a profession. Her book, Notes on Nursing, What It Is and What It Is Not, in 1859. Her philosophy was on health, illness and the nurse's role. And her focus was on patient care, especially the environment, cleanliness, asepsis, and hopefully promoting rehabilitation and a positive outcome in recovery. She also indicated the importance of observation and documentation, and was the first nursing statistician. She was very into nursing statistics. Then we have Virginia Henderson, and she earned the title of foremost nurse of the 20th century because her contributions were compared to that of Florence Nightingale, which were considerable. And she created a theory called the nursing need theory in 1953. And this theory defined nursing as unique, assisting individuals to gain independence in relation to the performance of activities related to daily living, which contributed to health and rehabilitation and recovery, or a peaceful death. And she demonstrated that a nurse's role was to partner with the patient and there were 14 basic needs, which I'm not going to review. Then you've got Jean Watson, who was an American nurse theorist, a nursing professor, who defined nursing as caring with her theory of human caring. And the process is basically included to embrace caring, altruistic values, practice loving kindness with self, inspire faith, hope, and honour everyone, trust self and others by nurturing individual beliefs and personal growth and practices. And this was created between the time period 1975 to 1979. And her theory was basically created to find a common meaning for nurses from all over the world, which has been recognised globally. Then there's Dorethea Orem, and it was her self-care deficit model in 1971 that's been used in the context of the nursing process to teach patients to increase self-care. And it also helps nurses to determine what aspects of patient care they should focus on in a given situation. It stresses the importance of patients themselves to maintain their independence, their autonomy over their care processes. These are all nursing theorists that contributed to us and what we do today. Then you have Imogene King with her goal attainment theory, 1960, which focused on the settling and attainment of certain life goals in three contexts: personal, interpersonal, and social. And she emphasised that the nurse and the patient are partners when communicating information, setting goals, and taking actions to achieve those goals. Then you have Sister Callista Roy, who was an American nun, nursing theorist, professor, and she's known for creating what is called the adaptation model of nursing in 1976. And it views the individual as a set of interrelated systems, biological, psychological, and social. And she saw nursing as a humanistic discipline that emphasised a person's adapting and coping abilities. Hildegard Peplau, also an American nursing theorist, and she created the interpersonal relations model in nursing in 1952. And it stated the importance of the therapeutic nurse and the patient relationship. And the nurse has 6 roles: counsellor, resource, teacher, technical expert, surrogate, leader. Ida Jean Orlando, a nursing theorist known for creating what was called the dynamic nurse-patient relationship model in 1961. This emphasised the importance of observation and observing patients' verbal and non-verbal cues or behaviour. The theory explains that the role of the nurse is to find out and meet the patient's immediate needs for help. According to the theory, all patients' behaviour can be a cry for help. Madeleine Leininger, another very famous nursing theorist. She's an American nursing theorist, and she developed the concept of what is called transcultural nursing. And the first prototype was 1961. She had many thereafter. Her cultural care theory defines nursing as a learned, scientific and humanistic profession. And the focus is on human care phenomena and caring activities. Why? To help support, facilitate or enable patients to maintain or regain health in culturally meaningful ways. According to the culture, we're all different. Or to help them face bad situations. or their handicaps, or their imminent death. All these nursing theorists contributed to the profession of nursing. And all their theories, and this is not all of them, there are many, many others. I've just highlighted the most significant ones from my perspective. And they all contribute to what we call holistic nursing. Not just seeing the patient as one aspect, but multiple aspects. Pluralistic, which again we'll be looking at as we move on. Then we have theory-based education. And theory-based education basically incorporates PhD nursing, which again I'm sure you're going to migrate to and evolve to. PhD nursing is a research degree that generates new discipline-specific knowledge, which means when you do your PhD, it's going to contribute to the knowledge base of nursing. Then you have the master's degree in nursing. That's you. And this employs theoretical perspectives focused on the patient for specific nursing outcomes, based practice on evidence from research and experience. The Bachelor of Science in Nursing introduces students to research, the research process, and the theories that guide it. When it comes to PhD is more research orientated. It's the program for nurses to pursue their career pathway, whether it's clinical, education or research. There are lots of PhD prepared nurses who teach, conduct research, evaluate programs, write books, lead healthcare organisations and work for the government, as they do here. More than anything, however, a nurse with a PhD has the training needed to conduct research and add to the body of knowledge, nursing research knowledge. Okay. Now let's review and look at theory-based practice. And this is practice or theory-related practice that occurs when nurses intentionally structure their practice around a particular nursing theory and use it to guide their practice. This could be in medical surgical nursing. This could be in mental health nursing. This could be in critical care nursing. And what it does is provide a systematic method for nursing practices that are consistent and guide decision making in that process. However, if something's identified, it challenges conventional views of patients, illness, healthcare delivery, and traditional nursing interventions. And look, these could include Peplau, the interpersonal model, 1952. Orem, the self-care model, 1980. Roy, the adaptation model, 1976. According to Peplau, 1987, theories which explain reoccurring health problems are the major tools for all of us as professional nurses. And the benefits for theory-based practice is that it explains the practice to others with a rationale. It passes on knowledge to not only students, but post-registration nurses as well, at all levels. It contributes to professional autonomy, and it develops analytic skills, challenges thinking, and clarifies nurses' values and assumptions about care. Theory-based research is also important. And since Nightingale's time, the Nightingale era, which commenced in 1859, significant research has been done in nursing. And nursing research is added to the nursing knowledge base. And as a consequence of that, it enables nurses to improve quality of care, patient safety, and this is through evidence-based practice. Theory is integral to nursing research, and both are vital to nursing practice and the Future of Nursing. Interestingly enough, in 1993 in Malaysia, the first university program started at the University of Malaya, and it admitted diploma nurses to prepare them to become nurse educators and nurse administrators. A 3-year program, the Bachelor of Science in Nursing, with honours. In the 21st century, it also marks the beginning of the establishment of postgraduate nursing programs in clinical nursing, namely commencing at the University of Malaya, UITM and UKM. The emphasis was on clinical to establish graduates in the context of experience as experts in order to teach them to promote education in Malaysia. And it's the clinical postgraduate nursing education that's seen as another positive milestone for nursing in Malaysia. 3 public universities offer Masters in Nursing degrees in critical care, women's health, clinical specialties such as midwifery, mental health and community, etc. Now let's look at nursing as a science. And nursing as a science is the examination of laws, theories, and the concept of nursing. For nurses to practice safe nursing, they've got to be knowledgeable in the sciences, the basic medical sciences, the fundamental nursing sciences, and these are all incorporated into practice. Practices in nursing are based on data that's been collected and validated from scientific research trials, which were obtained from patient disease-related situations or events. Science and nursing. What is science? Science refers to a knowledge which is rigorous, structured, and systematic. Recognition of science as a specialised form in nursing, however, is recent. Science has specific methodologies and methods to evaluate credibility. Is it credible? Is it valid? Is it reliable? All terms that you're going to become familiar with if you're not familiar with them. The nursing discipline, however, has got a human component, and it includes expectations and standards for nurses and their patients. And it's interestingly enough to know and note that knowledge can change rapidly and radically, and nurses must therefore discover and secure what is considered best practice so that they can practice it. So science and nursing then is change, and these changes are evolutionary, which means they occur over a period of time, but not necessarily as a progression, which basically means they don't have to progress unless absolutely necessary. This is the evolution of nursing practices. Nursing as a discipline articulates or states or indicates the components of nursing's knowledge base. And this always has raised questions about what signifies nursing. What identifies nursing? What individualizes nursing as a profession, as a discipline? And what signifies other healthcare disciplines? What makes us unique in nursing compared to medicine, physiotherapy, pharmaceuticals, occupational therapy? Nursing does have a diagnosis. It does have classifications that have been developed to respond to these questions. And intuition and critical thinking have also been examined as requirements due to their importance as tools for nurses, which I indicated earlier when we talk about tacit knowledge and intuitional knowledge. And it's interesting here, look at the caption there with the diagram. Nurse has a gut feeling. It can't be taught, however, it can be fine-tuned. which basically what they're saying is, don't ignore your tacit feelings, your intuition, your gut feelings. You can fine-tune them because they are definitely relevant as a nurse. Nursing education. There's a history. Nursing education was initially, certainly in my day and in Malaysia, possibly still, referred to as training due to the prevalence of the on-job apprenticeships. When I did my nursing certificate many years ago, it was an apprenticeship. I needed a job, I needed the money, I needed to support my family, and I needed to have a career. Training, however, was considered problematic because it focused on the ability to perform tasks rather than understand the purpose of nursing actions. It was task orientation. You did this, you did this, you did this, you did it A, B, C, D, E, F, G. If, for example, there wasn't a H, you couldn't move on to I because of the task orientation. As education shifted from training to learning, it was taught in hospitals by medical physicians and gradually evolved and made the transition into universities, into the departments of nursing with nursing lecturers. Interestingly enough, here, just to re-emphasise, in 1993, the Bachelor of Science nursing program, University of Malaya. 2001, Master of Science in Nursing. 2007, PhD commenced at the University of Malaya in KL. We still have a long way to go to encourage nurses in Malaysia to do their master's degree and then evolve into the PhD programs. This is essential for nurses to be professionals. Defining nursing as a discipline, well, many attempts have been made to define nursing, and it focused on education and sought to develop nursing and explain nursing as a unique discipline that has its own structure, its own framework, and its own boundaries. If it was devoted to ensuring that nursing research was always about nursing, not just research was being performed by nurses, and often by other disciplines, for other disciplines, not for nursing and not about nursing. It was important that we all understood the substantive structure and syntax or language that nurses had. And this led to the focus of development and led to nurses adapting a logical, positive approach. Now that's problematic. As a philosophy, the positive approach, or the philosophy of positivism, adheres to the view that only factual knowledge is important. Facts gained through observation, which is from our senses. And this included measurement. And only observation and measurement, numbers, are trustworthy. In positivism, the studies, the role of the researcher is very limited to data collection and interpretation in an objective way, not a subjective way. And the epistemology, which again you will be exposed to, if not already, has a positive approach. Epistemology, however, in the positive qualitative research paradigm, focuses on searching through non-statistical means, non-statistical causal relationships with different elements of reality, and these are summarized in patterns to generalized findings. Qualitative methods extend the depth of positivist research, which has typically been quantitative, which again you'll be discussing, if not already, in future lectures. So nursing as a profession then, the concept of nursing as a professional discipline came from the nature as applied to science. The distinction was appropriate because, again, we needed it for licensure to become registered, but it was problematic from academics who were not of a scientific background. And the academic association and acceptance was negligible. There were also concerns about, nursing uses knowledge that comes from medicine. It's not really nursing. Nursing borrows knowledge from other disciplines which are not nursing. We didn't have our own knowledge base. So it was important that the knowledge addressed the epistemic needs of nurses and nurses who generated data. So a nursing profession then, combining the professional and academic knowledge, resulted in a very complex, integrated educational system. Which basically means that, are we being taught to be doctors or are we being taught to be nurses? Epistemology is the study of what human beings know. And you'll be exposed to that. How they come to know and what they think they know. And what the criteria are for evaluating knowledge claims. Nursing epistemology, however, is the study of knowledge shared among members of the nursing discipline. And it's about patterns of knowing and knowledge that develop from them. And it's about the criteria that the knowledge claims. 3 types of knowledge specific to nursing as a discipline are clinical knowledge, conceptual knowledge, and empirical knowledge. The epistemic role consists of co-creating our convictions, or what we believe, our beliefs about the world and ourselves. Epistemology is the study of thinking, cognition, and has a historical science that deals with historically shaped conditioned belief systems. It sounds complex, and it is. Nursing emerged as a science. However, it followed what was referred to as logical positive influences. Nursing adapted this approach because they wanted to be a science. However, this philosophical approach emphasized forms of knowledge that were related to other disciplines. And this led nursing academics to suggest, well, look, there has to be a theoretical foundation for nursing knowledge. It can't come from other disciplines like medicine, pharmacy, physical therapy. If nursing knowledge is to be considered a science. Nursing knowledge, by definition, is what defines us as nurses. As opposed to, as I said, other professions like doctors, physiotherapists, pharmacists, occupational therapists, etc. And it helps to differentiate us from people who are not professional. They're just healthcare providers, lay carers, or care work supporters. And it's important that the knowledge used for nursing is evidence-based and produced by research findings. The primary purpose of theory in the profession of nursing is to improve practice by positively influencing the health and quality and life of our patients, as I indicated earlier. And the central concepts of health, person, environment, nursing, and caring are typically explored. The theoretical emphasis is always placed on the theories and our theorists related to the development of relationship modes and effective forms of communication, nursing therapeutics. It's about evidence-based practice. It's about evidence-based research. It's about evidence-based education. Nursing wanted a theory to establish them as a nursing science. However, science status required theory development using existing theories as a research base. A theory-driven focus led to a hard science, and understanding was problematic for nurses, academics, theorists from a humanistic and social standpoint. Because a logical positivistic approach didn't seem to fit. However, nurses then were left with three options. They either bit their tongue and fit into the logical positivist approach model, acknowledge that nursing is both an art and a science, or acknowledge that nursing didn't fit into the logical positivist ideology. Now, logical positivism, also called logical empiricism, was a philosophical movement that came from Europe in the 1920s, Vienna. And it characterized that scientific knowledge is the only kind of factual knowledge, and that all other doctrines, including nursing, are to be rejected. They're meaningless because they're not scientific. They're not objective. However, meanwhile, the art of nursing, if it was being considered, was more than a great deal of science. It was more than just knowing. The academics said it's about doing, and it bridges information from nurses to patients in a very skillful way. It's the application of all the science known to nursing in conjunction with providing the utmost care to patient needs. It was really the art and science of nursing, rejected by other scientific, objective, neutral disciplines. So the philosophical ideology that nursing was trying to be accepted into, logical positivism, didn't fit. It just didn't fit. And the imperfect fit of nursing and logical positivism implied that nursing, they said, didn't meet prevailing standards as a science, because it failed to address the legitimacy of the philosophy of positivism. And these types of problems still remain today. They're still an issue. Types of research: quantitative, qualitative, mixed method. And it's these types of problems, as I said, that are affecting the philosophy or the knowledge base. Nurses, however, should ask two evaluative questions when it comes to their philosophical ideology. Now remember, an ideology is just a set of beliefs, ideas, attitudes. They can be conscious or unconscious, held within the person, expressed by the person, and they reflect the understanding or the misconceptions of how the person or the nurse views the world. So the questions that you should ask when you're evaluating your philosophical ideology is this ideology beneficial to nursing? And if you go on to do research and you do your PhD and research thereafter, you're going to have to ask yourself these questions. Is it beneficial for nursing to utilise this ideology? And does this ideology actually progress nursing profession? Logical positivism has goals of precision and validity, and it ignores elements of phenomena that are not measurable. Unmeasurable phenomena. A philosophy of nursing is basically a statement that outlines a nurse's values, ethics, beliefs, as well as their motivation for being part of the profession. The philosophy of nursing helps you as a nurse identify the beliefs and theories that shape your choices that you make in your career and your job every day. So look, unmeasurable phenomena. Hypertension can be measured. It's basically just the pressure of blood against the blood vessel wall. Diabetes mellitus control. It can be measured with a serum glucose or a HbA1c level. They don't, however, document in a positivist philosophy how these conditions affect individuals, subjective. How these diagnoses or what it's like to live and try and maintain control of these pathological and physiological challenges. It's a holistic approach. And holistic care in nursing is a philosophy that guides the care that patients receive, which emerged from concepts related to humanism and holism. It refers to the provision of care to patients that are based on a mutual understanding of their physical, psychological, emotional, and spiritual dimensions. Holism, a holistic approach. This is not logical positivism. It's not positivism. It's not a positivist ideology. Nursing and the nursing profession do not fit into that philosophy. However, there are nurses and there are nursing academics that believe in that philosophy. It's up to you to decide which is relevant for you as a nurse, as a discipline, as a research approach. Now let's look at another aspect of nursing. Nursing as a paradigm, or what is nursing paradigm? And nursing as a paradigm represents global ideas about individuals, groups, situations, the phenomena of interest. It's a belief system. And there are 4 paradigms of nursing related to being a human being. The patient, holistically, the environment, health, and nursing. I mean, it explains the nature of human beings, their relationship with the environment, and the human universal healthcare processes. Thomas Samuel Kuhn, 1922, one of the most influential philosophers of science in the 20th century, probably the most influential, he wrote a book called The Structure of Scientific Revolutions. And it's one of the most cited academic books of all time related to what we're discussing here today. For Kuhn, the history of science was characterized by revolutions in the scientific outlook. And he said scientists have a world view, as you do, or a paradigm. A paradigm, from his perspective, is essentially universally recognizable scientific achievements for a time, and it provides model problems and solutions to practitioners. In the 70s, academics proposed that a philosophy of science is a shift from knowledge development. And as I said, Kuhn proposed that science philosophy examines the process rather than the product. How you do it, how you get it, rather than the end result. And this allowed judgments about science to be made relative to the viewpoint, and that not in reference to an objective reality. However, it wasn't accepted. Kuhn's influence was shorter-lived than logical positivists due to the post-modernism era. When we look at concept development, how all these thoughts came about, how these philosophies all developed, we look at what is called historicism. And historicism played a really important role in nursing development, particularly resolving conceptual problems. The study of history of nursing helps us to better understand the forces related to society and the issues that continue to confront us today. Understanding the history of nursing also allows us as nurses to gain an appreciation of the role of the profession and how it's been played in the global healthcare system. Concept development provides a foundational knowledge of caring or care concepts that enable us in the profession to explain what we do for our patients and the reasons for why we do it. This is particularly important because it helps nurses articulate evidence that justifies what they do, the methodologies behind their practice. Concept clarification and analysis were very popular in the 1980s, and they focused on theory development based on analysis, synthesis, and derivation in the three categories of concepts, statements, and theories. What we do, why we do it, how we do it. Postmodernism is a concept that we need to review as well. And postmodernism in Western philosophy occurred in about the late 20th century. And this was a movement that characterized broad skepticism, subjectivism, or sometimes referred to as relativism. They had a general suspicion of reason and an acute sensitivity to the role of ideology in asserting and maintaining political and economic power. And this related to research as well. Postmodernism rejects the possibility that we can have an objective reality or knowledge. It emphasises that there's a subjective nature to reality. Everybody's different, they're not all the same. Postmodernism values the subjective and multiple opinions of individuals and communities rather than, as in the logical positivist, predetermined rules for action. And in the postmodern era, it assigned value to multiple meanings rather than single authoritative voices of one expert researcher. The postmodernism emphasised hermeneutics, a narrative tradition, critical social theory, and feminism. And it was based on the idea that individual truths, as I indicated, individualised care and reflection of societal power was different. It was founded on uniqueness, diversity, power structures, and multiple realities as a result of human and social variation. And the multiple realities basically means there are different concepts. I mean, for example here, if you and I were asked the same question, how do you respond to this situation? We would answer it in different ways. They may be similar, but they're different because we're all unique. Hermeneutic philosophers examine, for example, how our cultural traditions, our language, our nature as historical beings make understanding possible. Hermeneutic thinkers argue that understanding is the interpretive act of integrating particular things such as words, signs, and events into a meaningful whole. It's the science of interpretation which originated from scriptures and branches of theology that dealt with the Bible. However, in research, hermeneutic phenomenology is a research method that uses qualitative research in fields of education and other human sciences, for example, nursing science. Hermeneutic is orientated to historical and relative meanings. Phenomenology here is orientated to universal and absolute essences. Other aspects that might have been important are feminism. And feminism, so what does that mean to us? Quite simply, feminism is about all genders having equal rights and opportunities, and it was important in the early stages of nursing ideology and philosophy development because it respected diverse women's experiences, identities, knowledge and strengths, and strived to empower all women to realise their full rights and value. Postmodernism is about traditional scientific principles that couldn't be applied to the study of human beings, given their individual human qualities and social context. It's about increasing emphasis on language and communication, which emerges to focus on people's stories, what they've got to tell you, which is subjective. And this fueled the growth of qualitative research, which is still controversial today. I know. Qualitative research isn't something that is foremost in Malaysian science-based research. I'm a qualitative researcher. I deal with people. I'm a nurse. I look at the human experience. I don't look at numbers. 1, 2, 3, 4, 5. But that doesn't mean quantitative research or methodologies aren't important in nursing. But qualitative research is more important from my perspective for nurses because it relates to the individual, the human being, their subjective experiences. I mean, if someone asked about pain, can you really measure pain? I don't think you can. You probably can if you use a rating scale of 1 to 10, numerical, 0 being the least, no pain, or 10 being the most, but everyone's pain is different. It's a subjective experience, which again is qualitative. And this led to the emergence of interpretive approaches to interpret data, not just to apply statistics to it. So postmodernism raised significant questions about objectivity and whether objectivity could actually be maintained as a science. And these worldviews merged to form 3 approaches. As I said, quantitative, qualitative, and a combination of both mixed methods. Quantitative approaches include positivism and post-positivism as a worldview. Qualitative approaches include constructivism, interpretivism, and transformative worldviews, and mixed methods correspond to pragmatism. The interpretive research is research paradigm that's based on the assumption that social reality or the worldview or how you live is not singular or objective, but rather it's shaped on human experiences and social contexts, which is also referred to as ontology. What's real in the world? And it's based on the best studied with a socio-historic context. It's subjective. Qualitative research is a form of social inquiry that focuses on the way people interpret and make sense of their experiences of the world, where they live. And the basis for qualitative research lies in the interpretive approach of how people see their social reality. It's a description of lived experiences of people. It's not numbers. Nursing isn't numbers. Nursing is people. Okay, now let's look at some of the emerging trends in nursing. And these trends have been emerging for a long time, over the last 10, 20 years. However, each era of nursing has contributed to the discipline, the knowledge base, building an identity for nursing as a profession. because it wasn't viewed as a profession at one point. And each viewpoint has got its merits, limitations, and a pluralistic approach, which is multifactual, is supported by some nursing academics and some not. Pluralism, just for completeness, is a term in philosophy meaning doctrine of multiplicity. And it's often used in opposition to monism, a doctrine of unity. In epistemology, pluralism is the position that there's not one consistent means of approaching truths about the world, but rather many. So, for example, pluralism is a philosophy or a philosophical standpoint which may support or oppose the nursing worldview. Pluralism basically says there are many truths in the world. So, for example, the example being, if you, I, someone else was asked a question, we may have all different answers because we all see things different. These are subjective, they're individualistic, they're pluralistic. It doesn't mean that they're wrong, they're all truths. Everybody sees the world in a different way. A child sees the world different to an adult. So, emerging trends basically refer to maybe we're heading into a pluralistic philosophy. Pluralistic qualitative research, for example, combines different qualitative methods with the same study. For example, applying different methods of analysis to the same data set. Pluralistic research is postmodern. The critical idea that we can get one ultimate version of the truth or one perspective isn't true. Methodological pluralism refers to the researchers using a range of methods on the same piece of research. And this allows for something called triangulation. Triangulation is using lots of different methods to get information. And when you get information about something using triangulation, for example, face-to-face interview, focus interview, using journals or reflective journals for the participants. And therefore, this increases the validity and reliability, or what I prefer to call quality or rigour in research. But triangulation can be applied for qualitative or quantitative data. And worldviews are basically sets of beliefs and assumptions that express how you, cultures, societies, interpret and explain experiences. They're beliefs and values for both patients and healthcare providers, if you want to look at it from that context. And these could contribute to very useful information. Pluralism is a philosophical standpoint which, however, could support or oppose the nursing worldview, because nurses may be quantitative, qualitative, or have mixed methodologies. Now let's review what is called pragmatism. And pragmatism is a philosophical movement that includes those who claim that an ideology or proposition is true if it works. It's practical. It can be applied in the clinical practice. If it's unpractical, can't be applied, they reject it. I think I'm a pragmatist too. I mean, theory's got to work in practice. Otherwise, what's the point of having the theory? Theory, practice. Pragmatism proposes that nursing knowledge should support nursing roles and duties and provide information about delivery of effective care and continuing development of the discipline. Pragmatism, however, in nursing has received relatively little attention as a nursing philosophy, though really it's well suited. We're practitioners. We like, we want, we demand the theory be able to be applied to practice. And this can be applied certainly for you as an advanced practitioner nurse with a master's degree and future doctoral degree, so that theory and practice correlate. Pragmatism views scientific inquiry as an attempt to find theories that work, that make a difference, to be practical, or solve an intellectual problem. As a research paradigm, however, pragmatism is based on the proportion or the proposition that researchers should use the philosophical and the methodological approach that works best for that particular research problem that's being investigated. So that means, as a pragmatist, you've got to choose the right design methodology for whatever research question that you ask. A pragmatic study focuses on an individual decision maker with an actual real world situation that's a problem, or something that you want to find out. The process of undertaking a pragmatic study is to first identify the problem, view it within its broadest context, and this leads to research inquiry, which seeks to better understand and ultimately solve the problem. Pragmatism is interested in solving problems. Pragmatism in nursing is interested in solving nursing patient care problems. So, in summary, nursing development has been non-linear and subject to various epistemologies. Professionally and academically, nursing has sought its own unique paradigm, still searching, still refining. Modern viewpoints utilise individual and discipline-wide approaches to nursing science. It's holistic. Future developments, however, will require philosophical blending and trend analysis. Conclusions. Theory of nursing knowledge and nursing practice presents a global perspective of science and art of nursing. It's a caring profession and takes into consideration the past, present and future impacts on nursing knowledge practice. Nursing education has to match healthcare needs for society, therefore theory has to complement practice. Nursing students today, however, whether they're undergraduate or postgraduate, are the beneficiaries of a long history of nursing in education and practice, and it's been characterised and sustained with an emphasis on advocacy to ensure that we, you, nurses, are prepared for practice. Thanks everybody. Check out any of the other Dr. Manny Learnshops on YouTube if you thought this was of any benefit to you. Bye for now.